This is the third pilot module in Nebraska's training for new staff members working in lead poisoning prevention. Here, we will focus on the health effects of lead exposure. You will need internet access to view the videos included in this module. You will also have an opportunity to view more information on specific topics by clicking on the links shown in the slides. Return to the module after viewing these links. Slides will automatically advance with each voiceover. If you wish to move more quickly, please right-click to advance to the next slide. Early in the module, you will see a link to a pretest. At the end, you will see a link to a post-test and evaluation. Please complete both before you exit this module. While we focus in this module on the effects of lead exposure on children, be aware that many of these effects, especially with higher levels of exposure, may appear in adults. In this context, neurobehavioral effects refer to the changes in the brain, central and peripheral nervous system, and the behavioral conditions that can result from those changes. Now take a minute to complete the pretest. When you are finished, return to the module. At the end of this module, we expect you will be better equipped to discuss health effects with the families you serve. As a reminder from the first module, the number of children under age 6 whose initial blood lead levels were at or greater than 5 micrograms per deciliter steadily declined from 2014 to 2018. In 2018, this represented 2.3% of the children tested, and of these children, 44% had confirmed blood lead levels of 5 micrograms per deciliter or greater. In the past, data on pre-confirmation blood lead levels of children in this age range indicated the majority of these blood tests were in the 5 to 9 micrograms per deciliter range. Roughly a third of the children with these blood lead levels lived in more rural settings. The majority were age 2 and under, and the vast majority were new cases and had not been a case in the prior year. So now that we have reminded ourselves about the distribution of Nebraska's elevated blood lead cases, let's focus on the health effects of lead exposure. Take a little time to read through the different health effects. Lead exposure affects a variety of processes, including neurological development, nerve conduction, production of red blood cells, and the metabolism of vitamins and minerals. Children with blood lead levels below 10 micrograms per deciliter are usually asymptomatic. The health impacts become more noticeable and severe as blood lead levels increase, with encephalopathy and even death occurring in ranges greater than 90 micrograms per deciliter. The last known death in the United States from exposure to lead-based paint hazards was in New Hampshire in 2000. The last known death from exposure to something other than residential paint came in Minneapolis in 2006, when a child swallowed a metal charm covered in lead paint. As the child's image shows, lead can affect many parts of the body. Children with blood lead levels below 10 micrograms per deciliter are generally asymptomatic. Prenatal exposure can result in premature birth and lower birth weight. Although any of the signs and symptoms in the graphic can occasionally occur at lower blood lead levels, higher levels tend to be associated with the more extreme effects. Changes in hemoglobin production more typically occur in the 20 to 45 micrograms per deciliter range. Colic, nausea, and constipation can be seen at the 20 to 60 micrograms per deciliter range. Later on, we can see bone loss, dental caries, and tooth loss. Lead exposure can also increase the risk of later asthma. Since high levels of exposure affect the functioning of kidneys, liver, endocrine, and gastrointestinal systems, weight loss as well as delays in growth and puberty can result. The Agency for Toxic Substances and Disease Registry, ATSDR, has a toxic profile that goes into more detail on these effects. Multiple exposures produce the blood lead levels you see in a test result. The main pathway for lead absorption in adults is through inhalation, but the main pathway for children is through ingestion. Absorption through the skin is not a common pathway, with the exception of the chemical tetraethyl lead. This is commonly found in jet fuels and was used as an anti-knock agent in gasoline. There is no barrier to lead transport from the placenta to the fetus. Maternal and fetal blood lead levels are nearly identical, so lead passes through the placenta easily. Children can effectively absorb about 50% of the lead they ingest. Lead moves from the blood to the soft tissues, such as the brain, the central and peripheral nervous system, bone marrow, the kidneys, and the liver. Lead passes through the blood-brain barrier because it can substitute for calcium ions. While some lead is excreted daily in the urine, more is excreted by adults than infants. Lead remains in the blood for months. Over time, most lead travels to the bone and binds with phosphate, where it has a half-life of 20 years. When the body is stressed, such as through poor diet or pregnancy, the lead deposited in bone can remobilize into the bloodstream. Chelation agents remove lead from blood, but do not remove lead from bone. After chelation treatment, lead in the bone migrates back into the blood. We often underestimate how much hand-to-mouth activity occurs in a young child. A study comparing parents' reports of mouthing behaviors to a video of their children over a 2-hour period found that parental report was not accurate. Children had far more hand-to-mouth behaviors than the parents reported. This is one of the reasons that frequent hand washing is not a good recommendation for preventing lead exposure. However, it is still an important public health message for controlling the spread of infection. Let's take a minute to test your knowledge of the last slides. Which of the following are health effects in children with an elevated blood lead level of 5 to 10 micrograms per deciliter? Encephalopathy, colic, loss of IQ, or anemia? The correct answer is loss of IQ. This is not something that either you, the parents, or the healthcare provider may see at early ages. IQ tests are rarely performed, if at all, until the child is school-aged. Encephalopathy usually is seen in very high EBLLs, especially those over 90 micrograms per deciliter. Colic is more common in the over 50 micrograms per deciliter range, and anemia, or changes in hemoglobin production, more typically occur in the 20 to 45 micrograms per deciliter range. But it is important to remember that these levels are not absolute. On occasion, children with very high blood lead levels may also be asymptomatic. Lead exposure affects many parts of the brain and therefore many different functions. This photo of MRI results shows changes to the prefrontal cortex that come from lead exposure. This is the part of the brain responsible for functions such as cognition, attention, reasoning, and impulse control. Lead also impacts other parts of the brain that regulate functions such as speech. The study also found that losses in gray matter were larger and more significant in men than in women. At birth, the brain is in an unfinished state. Most of its 100 billion neurons are not connected in networks. Brain development involves building the synaptic wiring of these networks. Lead has two impacts on neuron development. First, it interferes with the development of these branches. Second, it interferes with the deletion of unnecessary pathways. This is called apoptosis. It is the death of cells as a normal and controlled part of an organism's growth. If some pathways are not deleted, nerve signals will not be carried smoothly. Lead also affects how information is carried between neurons. When a calcium ion enters a neuron, the neuron releases neurotransmitters that send a signal to the next neuron. The lead ion can interfere with this process in two ways. First, when lead blocks calcium entry into the neuron releases less neurotransmitter and sends a weaker signal to the next neuron. Second, when calcium is not present, lead can also cause an abnormal release of neurotransmitters. Developmental effects are subtle, but we can see profound consequences at the population level from as little as a 5-point shift in IQ per 100 million people. On a population level, this can result in a much higher need for support services. Keep in mind that the population trends are not the same as individual diagnoses. The next video shows how these changes can occur. This 4-minute video is Dr. Bruce Lanphear's presentation on shifting the curve. The link to YouTube is provided in case you wish to view this later. Click on the video link if you wish to view it now. When you are finished, return to the module. There are many studies of the cognitive effects of elevated blood levels on IQ and other developmental functions. Canfield et al.'s 2000 research was one of the first to demonstrate the impact of blood lead concentrations below 10 micrograms per deciliter. The researchers found that every 10-point rise in blood lead levels is associated with a reduction of 2 to 4 points in IQ. From a national perspective, this means that a 10-point increase in blood lead levels doubles the number of children with lower IQs and halves the number of children with higher IQs. At blood lead levels below 10 micrograms per deciliter, IQ was reduced by 4 to 6 points. This is important since the reference value is now 5 micrograms per deciliter. Other research also suggests that medical interventions, such as chelation therapy, do not reverse the effect on IQ. There is some evidence that an enriched educational and play environment may have benefits for children under age 3, similar to the benefits seen in other early intervention programs. This comes from repatterning of the existing neural pathways, not from correcting prior damage produced by lead exposure. What are some of the other neurobehavioral consequences of lead exposure? CDC's Educational Interventions for Children Affected by Lead highlights a variety of effects. This document takes into account the impacts of blood lead levels at the CDC reference value. Why are other effects important? Measures such as IQ may not reveal deficits specific to children with high blood lead levels. IQ scores reflect the sum of performance on tests for many cognitive and psychomotor functions. Let's consider some of lead's specific impacts. Attention deficit hyperactivity disorder, or ADHD, affects approximately 3 to 7% of U.S. children. Researchers have found that the impact relates to the amount of exposure. In some cases, these effects were observed at blood lead levels well below 10 micrograms per deciliter. In one study, children with blood lead levels greater than 2 micrograms per deciliter were 4 times more likely to have a physician diagnosis of ADHD and to be on stimulant medication. Executive functions refer to strategic planning, control of impulses, organized searching, flexibility of thought and action, and self-monitoring of one's own behavior. Dopamine plays a key role in executive functions mediated by the prefrontal cortex. The dopamine neurotransmitter system is particularly sensitive to lead. Let's consider some other effects. Visual spatial skills involve visual perception, memory, organization, and reasoning. Tests of these abilities often involve fine motor skills. Changes in visual spatial skills are consistently associated with early lead exposure. Deficits can affect performance in reading and mathematics. Next, let's consider the behavioral consequences. A nationally representative sample found a significant association between low blood lead levels and an increased prevalence of conduct disorder symptoms. How does this occur? In addition to the changes in the prefrontal cortex, the group whose brain scans were shown in an earlier slide had altered production of myelin, or the insulative coating of the nerves. Poor myelin development leads to impaired nerve conduction. Many researchers suggest impaired cognitive abilities and subsequent academic failure can increase the risk for later delinquent behaviors. Nevin's research provides some additional insights. Lead in paint and gasoline was phased out in the late 1970s and 1980s. So, almost all children born in the U.S. from 1880 to 1980 were exposed to lead-contaminated dust and soil. The red line in the graph shows that from 1900 to 1998, U.S. homicide rates tracked with the U.S. per capita use of lead in paint and gasoline. This is represented by the black line. The green line shows that after lead in gasoline and paint was banned, the homicide rate dropped even more. Now let's consider speech and language disorders. High blood lead levels in childhood are associated with less activation in Broca's area, a region of speech production in the left hemisphere of the brain. High blood lead levels have also been associated with small but significant deficits in hearing and central auditory processing. Finally, let's look at fine and gross motor skills. Infant and preschool blood lead levels were associated with poorer scores on bilateral coordination, visual motor control, and the speed and dexterity of arm movements. Postural instability and unsteadiness have been consistently associated with high blood lead levels in early childhood. Lead thus affects children's long-term injury risk by harming their balance, coordination, and other skills. This may discourage their later participation in sports and affect their abilities to interact with peers. What are common neurobehavioral consequences of elevated blood lead levels? Impulse control, attention deficit, poor organizational skills, or speech and language disorders? What are common neurobehavioral consequences of EBLLs? All of them. One of your responsibilities is to be sure that parents know to watch for these symptoms and to advocate for services for their child when they are school-aged. It is important to recognize that these findings are not absolute. The effect of lead is individualized. Children with the same blood lead level may have very different symptoms. CDC's document, Managing Elevated Blood Lead Levels Among Young Children, which we mentioned in the first module, reviews a number of factors that can affect how symptoms are expressed. The timing of exposure, whether it's acute or chronic, the age when the outcomes are assessed, and the context of the assessment all have impact. For example, children who are 24 months of age are particularly sensitive to lead-associated effects on IQ. But more recent studies suggest that lead exposure beyond 2 years of age, when blood lead levels have tended to peak, may be even more strongly associated with cognitive development. This can have implications for school performance. Social class has also been shown to be a powerful predictor, with children of lower socioeconomic status having more symptoms than those with the same blood lead level but from a higher socioeconomic status. What this tells us is that we can't predict today if a child will have problems later on. We need to look at all risk factors for developmental problems. A single blood lead level cannot tell us the likelihood of specific developmental problems because these may vary depending on the characteristics of a particular child and his or her environment. As we mentioned earlier, risk factors are not the same as diagnoses. Blood lead level data need to be supplemented with thorough testing to diagnose developmental effects. Moreover, time lags between exposure and developmental changes are common. One implication of this lag is that developmental assessments conducted in very young children with high blood lead levels may not identify a child who is at risk for later problems. Many medical providers, parents, and educators may not know the critical times when the effects of exposure are most likely to be seen at school. This will be something that you may need to incorporate into your educational messages. Different skills are required for academic success at different transition points in school. In the first grade, children are learning to read and perform basic arithmetic. In the fourth grade, they are reading to learn or using those skills to learn new material. In the 6th or 7th grades, they use higher order planning and organizational skills to complete long-term projects. Elevated blood lead levels have been associated with difficulties with all three types of skills. So let's put some of the information in this module to action. Let's say we have a 2-year-old child with a confirmed blood lead level of 20 micrograms per deciliter. Which of these health and behavioral conditions would you attribute to his lead exposure? What will you say when you talk to the family? The point of this exercise is to know when to alert the family to pay attention to these signs and symptoms. Each of these conditions can be seen in 2-year-olds, but some are more typical at higher blood lead levels. Your job is to provide the right information to parents without adding to their stress. Let's go through these systematically. Seizures can be associated with high blood lead levels, but this child has a blood lead level of 20. Maybe there's another cause for the seizures, such as fever or other neurological conditions. Clumsiness is typical for 2-year-olds, but it is also something to monitor. It could signal peripheral nerve function issues. Many children are only starting to produce 2-word sentences at age 2, so you should not automatically assume a speech delay is related to this blood lead level. You would need to know about how the child was exposed to lead and for how long. But if the child is not talking at all, this may signal a hearing problem or a need for a developmental assessment, and maybe referral to early interventions. Tantrums are common for toddlers, but a child with ongoing problems with impulse control, distractibility, and reckless behavior should be evaluated for attention deficit disorders. Few wet diapers are more likely to be the result of dehydration. Kidney damage usually is not seen until higher blood lead levels. Anemia can be related to lead exposure, but a significant anemia is usually seen at higher ranges. However, lead can interfere with heme production. So, iron deficiency should also be checked, and a referral to WIC might be in order if the child qualifies for these services. Here are some research articles you may wish to examine in more detail at a later time. Here are other agency publications that might be helpful. Take a minute to review these key messages. We hope that this module has improved your understanding of some of the common health conditions that result from exposure to lead. Please click on the link to complete the post-test and evaluation. Thank you.